Thank you, Jorina. I'm going to talk a little bit about how to use the pandemic checklist at the local level and then elaborate a little bit on some security concerns while reopening. So I wanted to get the obvious out of the way first. This is a pandemic. This is an unprecedented event for most, if not all of us. And so we're all kind of learning as on the fly. And so we're trying to help our partners put it all together. And the first thing that most everyone should do is to contact your local or state health department. You want to coordinate with these folks because they have the guidance that you need. They can keep you up to date with the most current guidance. And it's really good to have a working relationship with your Department of Health at any time, but it's of paramount importance right now. So you want to make good contact with them. And throughout the pandemic, you want to keep in touch with them and coordinate your efforts with theirs. There's essentially four components, as Dorina mentioned, to the checklist: the reopen, reentry, safety and security, health and hygiene, and the continuity and after action review. Basically, the reopen and reentry, as Dorina said, it's a strategy for ramping back up after your faith-based organization, your house of worship, has been closed for anywhere from 6 weeks, 2 months, could be 3 months. You've got to get back together. You've got to get reorganized, and you need a good strategy for doing that. So again, you want to coordinate with your local health department, and I'll reinforce this a couple of times. Make sure you maintain contact with them as you're reopening. As you're putting your plan together to reopen, I suggest strongly that you encourage your vulnerable populations to stay home. You may be reopening your facilities, but your vulnerable populations, primarily elderly folks, hopefully have access to virtual services. And it's going to be hard for them for certain, but it's best, at least during the first and second phase of the reopening, to encourage these folks to stay home. You need to determine how you're going to create your social distancing that you will need to utilize when you're reopening and conducting services. You might want to use the 6-foot social distancing standard that's been used throughout the pandemic. Some people are using the 25% of maximum capacity of the facility. Some folks are using one person per 200 square foot. Whichever standard you use, you need to communicate that throughout your organization to make sure everyone's aware of that. The safety and security function, it's basically, if you have a security team, to get this team back together, get reorganized, get communicating, get talking about your policies and procedures, revising any plans that you have, creating new plans. If you're a smaller organization and you don't have a security team, then it's a matter of your leadership, pastors, ministers, priests, elders, deacons, getting together and determining how you're going to keep your folks safe during this reopening stage and from that point forward. Review any existing plans that you have and make adjustments as necessary. And you need to determine how you are going to enforce the public health guidance and the local health requirements, as I mentioned, with whatever standards you're going to use. And if you haven't done this already, and if you don't normally engage with your local law enforcement, now is a really good time to do that. It's always good to have a good working relationship, not only with your public health department, but with your local law enforcement. And you need to re-engage with them again, let them know that you're opening. They can give you some advice. You can let them know what you're doing, and it'll help you out quite a bit. The health and hygiene, again, we've got the public health guidance and determining what measures you're going to use. Critically important that you determine what disinfection protocols you're going to use. The CDC has come out with different guidelines on disinfecting. They've also changed a bit in their view on transmission of the disease through surface touching. Nonetheless, you need to be really upfront and concerned about the disinfecting process. Use it throughout your facility. And another suggestion, to limit your entry points into your facility, your sanctuary. You want to cut down on potential areas where the virus could be spread. Some partners, some FBOs, faith-based organizations, have eliminated handshakes, hugs, sharing of hymnals. One thing that's been a topic in the guidance lately has to do with choirs or singing during the services. Each organization is going to treat that differently, but you want to think hard about whether or not you're going to have folks singing throughout the service. There's been science and there's CDC and other guidance about the projection of the aerosols and the droplets when singing, so you need to take that into consideration. And you also need to focus on the mental health issues that might come up based on the time folks have spent away from their house of worship and what sort of impact that may have had on them. The continuity and after action review is basically how are you going to get your operation back running, and you've determined now, if you continue to operate, how it works best for your organization to do that. You have folks working at home, you have folks working at other locations. How you maintain the continuity of your operation. This is important. You're learning on the fly, and you want to document that along with the after action for use in the future. It's going to be very helpful as you approach another crisis, disaster of any proportion, man-made or natural. This checklist is very extensive. If you've had the opportunity to take a look at it, the whole document is like 17 pages, but 7 of those pages are the checklist, and there's an awful lot of information in there. My recommendation to you is take what works for you out of that checklist and disregard the rest. Smaller organizations, churches, houses of worship with 15 to 50 members, they may take 2 or 3 or 4 general concepts out of that checklist and mold that to meet their needs. Larger organizations, churches, houses of worship, upwards to 40,000 people, they've got an entirely different operation, extensive security, extensive infrastructure plan. They're going to be taking a lot more out of this checklist to use for them. So just take what works for you and leave the rest. Don't get hung up on the details. Otherwise, it's going to be hard to accomplish any of your objectives. Your objectives. Use the information in the checklist to design, prepare, or re-examine your plans. If you don't have a plan, you need to start one right away. If you have a plan, you need to review that and revise it as necessary. Use the checklist to assist you in developing and revising your plans, and reevaluate everything in light of the pandemic. Things have changed, and you need to make those adjustments as necessary. Documenting your response process as you go along is going to help you later on. How are you going to continue to keep your business operation running, your religious facility operating, services and other activities? You want to document your response to the reopening, all the steps along the way, each phase, first, second, and third phase. Document what's working for you, what's not working for you, what you've had to change, how you've had to make revisions on the fly. Make sure you document it, take notes in each phase, and then towards the end of the event, whenever that might be, you're going to meet. Hopefully you can meet a few times, compare notes, and then throughout this process, compile a report, an after-action review, and then spend some time going through it, revise it as necessary, get input from members of your security teams, from your leadership, everyone in the organization having some input, put it all together, finalize it, and then publish it. Make sure you get it to people, because it's going to be very helpful to you in the future. A crisis creates an opportunity. And in this case, the opportunity is to improve your plans, improve your operation, and be just a little bit more prepared the next time you're faced with a crisis or an emergency. Okay, next slide, please.